Lovely. So thank you so much, Kat, for joining me today. It's lovely to meet you, and it's lovely to have you on our Dokkcast. Welcome. Um, Tell me a little bit about yourself, what you're doing, who you are. Introduce yourself to the audience, and we'll go from there.
Well, thank you for having me. My name's Kat. I'm a post-CCT fellow in trauma and orthopaedics. Currently doing my first fellowship in foot and ankle surgery with an interest also in lower limb trauma. Um, I've actually been an orthopaedic surgeon for 12 years. I had three children during my training, so I've taken the rather scenic route to get to where I am. But that's been a very important part of my life, juggling family life and being a doctor. I remember when I was younger and people still say things like this today that you can't be a woman in surgery with a family and be a surgeon, and it's just such nonsense. You can definitely juggle both. And actually, I recently spoke to someone who said that working mums are the most organised people that they'd ever met.
Yeah, 100%. I could not agree with that more. For those of us who are not in the medical specialty, tell us a little bit about what an orthopedic surgeon does, because they
Oh
kind
yeah.
of things orthopedics, they don't necessarily know where that overlaps with anything else to do with joints or bones or tissues, etc. What is an orthopedic surgeon? And then second follow-up question to that is why orthopedics for you?
Mhm. So orthopedics is treating mostly bone and joint conditions. So that things like arthritis. We treat a lot of tendon and muscle problems sometimes,
Hmm.
um, and then trauma. So I do a lot of broken bones, ligament injuries around the foot and ankle, that sort of thing.
Hmm.
Um, and then why an orthopedic surgeon? I'll say what I said in my interview when I got the job, which was I really like power tools. And if I wasn't an orthopedic surgeon, I'd have probably ended up being something like a carpenter or a joiner. I really like putting things together and building things. I find it very satisfying, and it's like Meccano with people. Um, and then on a more personal side, I really enjoy meeting people, interacting with my patients, and it's not all about surgery. And as a surgeon, I think a lot of us forget that there's a lot of conditions that we see that actually you really want to try and avoid operations for people, and it's trying to educate your patients and motivate and empower them to treating them with things such as physiotherapy, and take control of their own recovery. Really.
Yeah, giving them that agency. And when did you know that that was it for you? Because actually, I think it's one of those questions that we get asked a lot, and and we're kindred spirits in some ways because I'm an ENT surgeon, and exactly, we've got very clear reasons as to how we landed in that spot. I think it's very rare that you go to medical school and think, I am going to be an orthopedic
Mm.
surgeon. What was your
Yeah.
journey to that point like? And
Yeah.
yeah, what were the things that you thought? And in some ways, there'll be people watching this in medical school thinking, I don't know what I want to do, and it's a really nice way of hearing from others who've been through that journey and their decision pathway.
Yeah, that's a really good point. So in medical school, I absolutely did not know what I wanted to do. In hindsight, I have always been a surgeon, and I think I'd have never ended up being anything else now that I know my personality as I do. And then at med school, in my last year, I had a special study module in max fac surgery.
Mm,
And it was the most mind blowing thing I'd ever seen. Um, I remember watching them do a fibula free flap graft for jaw cancer, which is where you take out the bone, the muscle, and the skin in part of the leg, and you put it in their face to replace the bit of bone with the cancer in. And my mind, this I can't even describe it. When they plumbed in the artery and then the blood was coming out the vein at the other end, I was like, "Wow, this is really cool surgery. This is phenomenal." And then I rearranged a second study module in the same department because I enjoyed it so much.
mm,
And at that point, I wanted to be a max fac surgeon, and you have to do both dentistry and medicine.
yeah.
Um, so at the end of my second year of medical training, my foundation year 2, I applied for surgical training and for dentistry.
Uh-huh.
Um, but then I got offered my job for surgery before they'd even announced the interview dates to do dentistry.
Yeah.
And I thought, well, I don't really want to decline the surgery offer. in case I don't get the dentist you want. And I have to do the 2 years of surgical training anyway. So I accepted that and withdrew my dentistry application and thought, well, I'll just reapply in 2 years' time.
Yeah.
Um, and my first job was orthopedics, which I really enjoyed. And I'm sort of decided maybe that's what I wanted to do. And then one of the other trainees wanted to swap jobs with me. They wanted to do a bit more general surgery,
Hmm.
which like intestines and stuff.
Yeah.
And they offered me a swap to more orthopedics. And at that point, I was toying with the idea of doing orthopedics. So I was like, oh, great. Yeah, I'll swap that job.
Yeah.
Um, I had an absolutely fabulous job. I met the man that's now my husband, and I
Oh,
decided I didn't want to do anything else apart from orthopedics, and that's how it went. So that's basically, I had a job in orthopedics. I absolutely loved it, and decided I
yeah.
never wanted to do anything else again.
Yeah. And that's a really interesting path because it actually reinforces how important those moments, experiential moments, i.e., what you experience, how that
Mm.
attachment makes you feel to some
Yeah.
degree. And it's about feeling valued,
Mm.
contributing to the team. Because I don't know if you felt this way, but when you're quite junior as a doctor and a surgeon, it's easy to not feel very relevant, perhaps. I
Very
don't,
much.
everyone feels. Do you agree with that statement? I don't want to put
I
words in your mouth.
No, no, I completely agree. My first orthopedic attachment as a core surgical trainee was in a department where you were treated very well as a core surgical trainee.
Mm.
Um, and we were very much valued and taught very well. So I was taught to operate, and I wasn't doing what a lot of junior doctors at that stage do, which is a lot of ward work, which is
Hmm.
very necessary and very important, but it's not what you love. The
Yes.
sort of surgery and the patient interaction is what I find to be the best thing. And without a doubt, if I hadn't been in that department with those people, um, and hadn't had that experience,
Mm.
I don't think I would be thinking, "Oh, this is something I want to do for the rest of my life."
Yeah. I think that's a really important point. And one of the challenges now, as you know, and you're sort of coming definitely at the other end of your training and will be looking for that consultant post very, very soon, is how do we make sure as consultants and trainers that we keep advocating for the trainees? um,
Mm,
because there is so much work to be done, and a lot of that work may be administrative and maybe a little bit more run of the mill. And exactly as you say, surgeons are operating, whether you're a trainee surgeon or a consultant at any stage of your career. So it requires a high level of engagement. Um, there are sort of stereotypes about orthopedic surgeons, which I think if you're in
mm.
the
Yeah.
in the business of medicine and surgery, you know about it. Tell us a bit about that. How did that kind of not necessarily play into your decision making, but how do you feel
Yeah.
about that? And by the way, every surgical specialty has a bit of that, don't they? But orthopedics
Yeah.
maybe more than others. Do you agree
Yeah.
with that?
Yeah, there's definitely a reputation of orthopedics, and so
Yeah.
historically, orthopedic surgeons were big blokes normally, you know, rugby players, that sort of thing. And there's a sort of, I don't want to say joke, but like knuckle draggers, so very strong and not very clever. Um, so that orthopedics has got this reputation of people who like to bash things with a hammer, which is not untrue.
Yeah.
Um, But actually, I think if you feel you need to be strong to do orthopedics, then you're doing it wrong.
Yes.
Um, I know 5 foot female hip surgeons who can do the job perfectly well if you get your technique correct. Um, and I think it's really important to dispel those myths about any specialty, actually, but particularly in orthopedics, where historically it's been very male dominated, um, and probably quite aggressive,
Yeah.
that actually, it shouldn't be like that, and it's not like that anymore.
Yeah. And when you say it's not like that anymore, do you think that that change, is it just the times and everything changes with the times, or what do you think has changed? And it
Mm.
sounds like it's changed for the better. What do you think has played into that? And part of the sort of the nugget of that question in there is how do we make surgery an attractive specialty in general? Because actually, by the way,
Mm.
that's declining. People who are coming out of medical school and going towards
Yeah.
surgery getting less, women particularly. So, what do you feel were the
Mm.
drivers behind that positive change, and how do we learn from that, both in
Yeah.
orthopedic but other specialties?
I think a lot of it is a change in culture in the workplace environment, not just in medicine and surgery, but the idea that we don't accept bullying behavior anymore.
Yeah,
Um, People who deliberately belittle people and make their life difficult and mock them is not accepted anymore. And there's been some great work done through the Royal College of Surgeons through recent years, particularly on bullying in orthopaedics, because that was quite a notorious area. And then I think the overall change in culture, and I think more women in surgery has made a difference. And I don't want to make sort of gender stereotypes, but I think in large, the attitude of women can be quite different to men.
yeah,
Um, and I think having a more varied workforce with more personalities makes a big difference to that. Historically, people tend to employ people like themselves because they feel comfortable with them. And so you end up with a lot of people with the same background and the same opinions who will back each other up in the same way. And actually, having a much more diverse department means that people will challenge you when you act or say in ways that they're not comfortable with. And I think really important.
yeah, 100%. And I think it would be, you know, remiss of us, certainly of me, if I didn't bring up the point that obviously it's two female surgeons talking to each other, and, which is great. One of the things that still to some degree saddens me is that when you look back in 92, which was, before I started med school, but certainly sort of going into that arena, female surgeons were less than 3%. And at this
Mm.
point in time, I think it was last done in 23, was only up to just around 14%. So it's
Mm.
still a long way to go. If we're going at this
Yeah.
rate, it's going to take us like, another 25 years to get anywhere near parity. Um, what has your journey been like in terms of choosing surgery, as a woman, and positives, negatives, and importantly, learnings? And
Mm.
how was that for you? And now that you're sort of obviously a very senior trainee about to, get into a consultant substantive position, how do you look back on that?
Mm. I have to say, I don't know if I've just been very lucky with the people that I've had interactions with in the departments I've been in, or or whether I'm just not that observant and people have made comments that I've not picked up on. And actually, I don't always read people very well, so it's quite possible people have made disparaging comments that I have just not noticed and let go. And it's weird you say that because when I first started surgical training, apparently an anaesthetist made a comment about me during an operation, and I was busy operating and was completely oblivious to this. But the surgeon, the consultant I was with, made them come and apologize to me afterwards, even though I hadn't actually heard what they said. Um, but I was really touched by that they'd heard someone say something that they thought was inappropriate, and they said, first of all, that's not on, but also you must go and apologize. Um, and I think a lot of it is other people standing up for you in moments like that, and not just about gender, but in race and all that sort of thing as well. That when you hear something that's inappropriate, that you will stand up for the people around you and not just let it happen.
Yeah. There's something very strong about that because it actually sends a signal. And that person who would have made that comment is not going to make that comment again. They probably are
Mm.
not going to have a personality transplant and they may think it, but
Yeah.
at least they're not going to be saying it. And I think one is obviously just what people say and think, and
Hmm.
that comes with it. And then there's the cold, harsh reality of actually saying, I also would like a family and
Mm.
all the other time pulls and commitments that come with that. Again, talk us through a little bit around how that journey was for you. Three kids is a
Mm.
quite a nice number of kids, right? And that's a
Yeah.
busy household.
Yeah.
Yeah, tell us a bit about that and how
Yeah.
the highs and lows. And to be honest, advice. It's one of the things I certainly remember at medical school. I asked someone, what do you want to do? And we're talking about this, and she said, "Oh, I'm not going to be a surgeon because I want to have a family." And I remember being so
Mm.
shocked that this
Yeah.
was they'd cut themselves off even before we, got anywhere
Yeah.
near the scalpel. So yeah, so how has that been for you? what worked, what didn't work, what were the pain points?
Yeah,
I'm sure there were many. And what advice do you think you'd give to someone else coming
yeah.
through?
So I'd always known that I wanted a family and that I wanted to have children, so that was an easy decision. Um, and a lot of people think that you can plan these things, and decide when it's gonna happen, and sometimes you just need to get on with things and let things happen. And I'd actually wanted to have children much earlier, but hadn't met the right person.
Mm,
Um, and I should probably declare both my parents are actually surgeons. Um, so my mum is a now retired O&G consultant, and she said to me, "Kat, look, get yourself a registrar number first, because then you've got job security."
yeah.
Um, and although I wanted to have kids earlier, that's how it ended up happening. And she was completely right. There's no stress about having to reapply for jobs once you've got a training number. You're fully protected in your job. I had the opportunity to work part time with no questions asked whatsoever. I have to say, I had a very supportive training program director who, when I said I wanted to work 50% after my first child was born, which is the lowest you can do and retain your training post, said, "That's fine. You know, it's going to take your training longer. I don't need to tell you that. You can do that."
Mm,
Um, and then I had colleagues in other rotations, who had children and wanted to be part-time, and they were like, "Oh, no, you can only do 80%. That's the only option." And they had a real fight trying to find that work-life balance, whereas I was sort of allowed to carve my own path.
mm,
And I was very well supported in that, actually.
yeah.
Um, and it is shocking what some people, say to you. I sometimes teach students surgical skills to students, and I remember um, one female surgeon who is a junior trainee saying, "Oh my goodness, I can't believe you're a surgeon and you've got children." And I was like, "Yeah, it's totally normal. What's the issue?" She's like, "I didn't think it was possible." And I
Yeah.
asked her, "Why do you think that?" And she said, "Oh well, one of our lecturers at university said that you can't have a family as a woman and have children." And I was like, "Oh, were they a surgeon?" She went, "No." "What were they?" "They were a GP." And I was like, "Well, how on earth would they know whether
Yeah.
you can be a surgeon and have a family?" And I have to say, I think my job, being a surgeon in a hospital, is much better than my colleagues who are GPs.
Mm.
Being a GP at the moment is an extremely hard job.
Really hard. They
Um,
get pummeled from every which way at the minute.
Absolutely, they're ridiculously overworked, and you have to know everything about everything, and everyone only wants to complain about you. Whereas I turn up and do my job, and then I go home. And I have
Yeah.
very little work to do at home because I do it all at work. Um, I have great colleagues, and I think the pressure from the hospital is less than it is in a GP surgery, and I think I probably work less hours than my colleagues in GP. So actually, I think someone saying, "Don't be a surgeon because you can't have the work-life balance," is total rubbish.
Yeah.
If you're organized, you can do absolutely whatever you want to do.
Yeah. And there's definitely a piece around the osmotic effect. So we had, if we have a really, really good role model, so in ENT, we had a very good
Mm,
role model as a female surgeon in a particular subset of ENT. And then you found a lot of other women went into that
mm.
subspecialty within ENT. So the role modeling piece absolutely works. And I think that visibility absolutely works. And you
Yeah.
can you can advocate for that. Um, but it is hard, right? When they are, particularly when they're quite small. Obviously, it all comes with challenges throughout that. Um, and obviously, this is about you. But no man or woman is an island,
Mm,
and there definitely is a piece around that support system around you. Um, you know, your partner, your friends, family, etc. How did you manage to kind of work that? Because of course, you've got to pull in your army, right? You've got to pull in as
yeah.
much as you can, and there's a piece around actually admitting that we can't do it all of the time,
Mm,
and neither were we meant to.
yeah. And it's different for every family and every individual about what you've got available. Um, so for us, basically, my my first daughter didn't sleep. And she went through a phase where she woke up every 20 minutes for like a year and a half.
Oh, wow.
Um,
That's
yeah,
and the worst of
she's
all.
I'll be honest, she's still God bless her, she's still terrible at sleeping, and now she's 10. Um, so my parents live far away, so good for holidays, no use for day-to-day stuff, but my husband was very supportive and, is and always has been a really involved and active dad, so between us, we would, we'd have a plan and we'd take it in turns over who would look after the kids when they woke up at night, who would get to have a lie-in on which day. So it was very even, and we very
Mm.
much worked as a team with our childcare.
Yeah.
Um, when the kids were all little, we had a nanny, and we're very lucky to be in the financial position where we could do that because actually paying her salary and her tax was more than I earned.
Yes.
Um, and actually, it's
I
funny, I spoke to
recognize
my
that story very well.
yeah, I spoke to my parents about this and they were said, "Oh yes, when you were little, we had to take out a loan to pay for a nanny, knowing that we'd be able to pay it back once you started school and we were consultants."
Yeah.
Um, so we were able to scrape things together, but my salary entirely went on childcare for sort of 4 years probably.
Yeah. And I think that's the thing, isn't it? You've got to invest in yourself, in your career as a team
Mm.
and say going to work. So now that you're coming out of the other end with CCT, what's your hopes and dreams in terms of what you want your consultant life to look like? And by the way, for those
Yeah.
who are sort of untrained in the whole UK sort of postgraduate medical training system, of course, you go through these foundation year core, higher surgical training, and then you become a consultant. And for years, until you were a consultant, which by the way may have been in your early 40s by the time you've done a
Mm,
degree and taken time out and had children, you were called a junior doctor, which kind
mm,
of we know other, no other professional field are you called a junior anything when you're as highly
yeah,
trained as that with 20 some years of experience behind you. But yes, but what does it look like for Cat as to, this is what I'd like to be when I'm, a consultant
yeah.
surgeon.
So my ideal place of work would be a relatively busy hospital. I like to keep myself busy. But I think the most important thing is actually the culture of the department.
Yeah.
Um, and I've said this to other places before. Like I commute quite far from my present job, and actually I've always commuted quite far, and I think it is absolutely worth it for working somewhere with the right culture. And I've worked in some places where honestly, if an ambulance took me there, I would crawl to another hospital. They were so terrible.
Yeah.
Um, so I would I'd be very picky when I eventually come to applying for consultant jobs. And I know that's a little bit of an arrogant thing to say, but I think for the rest of your working life, I think it's very important about not just the doctors, but the whole hospital. So the management structure there, how you're
Yeah.
treated as a human being and as an employee is really important. I do find a
100.
lot of people still make gender assumptions about things when you're a consultant. I
Mhm.
don't know if you saw last week, but the Royal College published an article about the number of female surgeons in private practice. Um,
Mhm.
and I don't know if it's right or wrong, but I don't necessarily read that and see it as a gender issue. Um, I've got no interest in private practice. I enjoy spending time with my children and my family, and I've got hobbies that I want to carry on with, and no amount of money is going to make me give that up.
Yes.
Um, and a lot of my colleagues assume as well that once you're a consultant, you're interested in private practice. And actually, I'm interested in having a job that I enjoy,
Yeah.
um, and a family life that I enjoy. And that's important for me is having that balance. I don't want a job that I hate, and I don't want to go home and be miserable.
Yeah. 100%. And actually, as you say, it's as with everything in medicine, it's about people. Who you're
Mm,
working with, and is that conducive to your um, growth and happiness in terms of professional fulfillment? Because by the way,
mm,
we give so much more at work than what we're paid to do, and have always
yeah,
done. Nobody goes
yeah.
into medicine. I hope you agree with this statement for the money.
No,
You
no,
hope you get a
certainly not here.
yeah. you know, um, And actually, which basically brings us to the last topic, which is essentially the role of social media and medicine, or rather, where those two overlap. There is so much out there, and I'm sure you get asked as well. I certainly do on a daily basis about some of the stuff people read online,
Yeah.
and they get so much quote unquote advice online. And as you know, UDoc was set up in order to give verified, sound information that you could
Mm,
trust, and taking out all the other noise that's around. So, what's your thoughts on the role of social media in serving that information piece,
mm,
both to within medicine/surgery, but also how we interact with the public and people looking just for information or actually looking for advice.
yeah. I think finding information that's real and that you can trust through social media can be really difficult.
100%.
Um, and certainly, I get a lot of patients saying, "Oh, I've seen this." I'm like, "I'm afraid that's total nonsense." And I also see I see a lot of fake ads. So companies advertising things, even claiming that they've been authorized by this medical society or whatever. And I read that, I think this is total nonsense as well. And um, our patients read that and think it's a reliable source, and it's not. So I think finding true and reliable information is really difficult. Um, and we and our patients don't necessarily know um, what what you can trust.
Yes. Yeah. Trust is a really important word, isn't it? And it's very,
Mm,
very difficult because a lot of what's out there is sort of almost financially, fiscally driven. So people are looking for the
mm,
clicks, they're looking for the eyeballs. And so the more I don't want to use the word extreme, but the more sort of out there that opinion is, the more it drives
mm,
engagement. And that is
yeah,
probably inversely related to how trustworthy or verifiable it is.
yeah,
What do you do in terms of getting involved? Because of, for a very long time, where certainly initially when sort of Facebook and some of this social media interaction started, a lot of doctors, this is going back 20 years or more now, were like, this is just not our field. This is a wild west out there. We're not engaging. I think those days, quite rightly, are long gone, and people are engaging. What do you
yeah.
think is the best way to engage with it if you're a medic
Mm.
or a doctor? And what do you do? What have you found that's worked for you?
Yeah. So I mostly use, from a medical point, social media to get and give advice
Uh-huh.
with and from other doctors, um, particularly other specialties who might be quite niche, or finding contacts in other hospitals to try and make connections for patients or other people looking for advice.
Mm,
But like one of the difficulties with social media is you can't always tell who it is that you're speaking to and whether they're legit.
mm.
Um, and it comes back to the trust issue, really.
Yeah.
Um, and I do enjoy that. So I've made contacts with people through social media that I find really useful in terms of advice for me and my patients. And I've given advice to other people in the same way. Um, but finding something that is, it's reliable. And so I'm in a couple of groups that are meant to be just doctors. And
Mhm.
you can feel it's a safe space sometimes for having a clinical discussion, and asking advice, but you can't do that on an open platform, really.
Or yeah, yeah, 100%. And how do you think people will look at what's out there? How do you think it's going to evolve in the say next 5 years? But 10 years is probably a little bit too long time to look at it, because
Mm,
people are getting more and more comfortable about getting that information and guidance online. What will be our
yeah,
role as medics, as doctors? Will AI put us out of a chat GPT, put us out of a job?
yeah. Um, I think when I look at a lot of stuff online, I sometimes find it difficult to work out what is self-promotion by the person posting it and what is information that's actually useful to me. So in medicine, a lot of people will post things, and I look at it and think, is this real, or are you just promoting your
Mm,
own service, or your own name? Um, so sometimes finding things that are useful without a person's ego in there as well can be quite difficult. Um,
definitely.
and I think in terms of the future, AI is both a great benefit and a real threat at the same time in terms of, well, like we're talking about truth and trust, that it does make it very difficult to know what's real and what isn't when you're watching videos, and even posts that aren't even written by a person, they're written by a bot because they've seen that you've clicked on things similar to this before, and then you read it and see the picture or the video and you think, hang on, this isn't real.
Yes. Yeah, yeah. I think that's gonna be a real challenge, and, I don't know if you agree with this statement, but I feel it's medicine at its very heart, it's about humanity, right?
Mm,
It's allowing, and I always say it's the greatest privilege to look after people at their most
mm,
vulnerable. You know,
yeah,
it's incumbent on us to be the best that we can be possibly because, they're in pain, they're in distress, and, and we are in that space where actually the vulnerability is at its most. And that's a human thing,
yeah, I
and that's a
completely
trust
agree.
thing.
The one of the best things about my job, and actually one of my favorite things, is not when people say, "Oh, you did a great operation," or anything like that. It's when people say things like, "Thank you for taking the time to listen to me,"
Mm.
or "You explained that in a way that no one's bothered to do before." It's those sort of comments that really make my day, is the human interaction,
Mm.
um, not not the bigger things that people think that it is.
Yeah, it's interesting, isn't it? Because they assume rightly that we have competence as
Mm,
surgeons. It is that kindness, which I know is slightly an overused word, but when
mm,
actually you feel it, particularly at moments of vulnerability, it's sort of transforming, and
yeah.
that's wonderful. Um, Beautiful. Thank you so much, Kat. I really, really enjoyed this. And I loved talking to a fellow female surgeon because I think, yes, there's still not enough of us, but
Not
it's
yet.
it's not yet, not yet. But it is, I think incumbent on us to sort of shape the next round, and how what that looks like, etc. And thank you so much for letting us know how you see the social media evolution. And yeah, and thank you for the time.
Thank you for having me. It's been a really interesting conversation.
Thank you, Kat.